Hannah, thank you so much for being on the show with me.
I'm super excited.
Could you share a little bit about why you're here talking about psychedelic assisted therapy, especially as it relates to intimacy and sex? But like, what's your journey been with this a little bit, and why is this of interest?
Yeah. Yeah. So I am a therapist. I've been working in the mental health field for about 10 years. I started my foray working in addiction, and that transformed over the years. And I got really involved in trauma treatment, did a bunch of training in modalities like EMDR. And then I had my first trauma treatment with psychedelics training. I did that. God, it's 2026. I'm like, how many years ago? I was like, everything's a blur after 2020, but
Right.
5 or 6 years ago now. And what I thought was really cool about the psychedelic world is it invited such a depth to not only my personal development, but my development as a therapist. And something that psychedelics, at least I found in my work, is that they let us explore things that are taboo a little bit more easily, it seems.
Okay.
And what I started to find is as a therapist working in trauma, and I started to, I mean, when we are talking trauma treatment, obviously it affects people's relationships. So I started getting further training in couples work. And I started to find that in all of my trauma treatment training and all of my couples therapy training, no one talked about sex. I don't know if that was your experience, but the psychedelic world, they are way more comfortable talking about and working on issues like sexuality and intimacy and sex. And so I was like, how do we blend the two? And how do we find the intersection between using psychedelics to kind of move through defenses and taboo and things that aren't okay to talk about, even in the therapy world, and blend the two? So I started incorporating the psychedelics into my practice 5 or 6 years ago, and it's involved so much to the point where I am working solely with couples and individuals around things like sexual trauma or intimacy issues and relational issues, of course. I think they go hand in hand with
Right. Right.
psychedelics.
Interesting. And I think people do, if they have any awareness of psychedelic assisted therapy, they're probably thinking about trauma,
Yeah.
right? PTSD, maybe depression, that kind of stuff. They may not have been aware of its use with intimacy and sex,
Yeah, a hundred
right?
percent. Yeah. I don't think it's as well known.
Hmm.
But it's definitely something that I think as psychedelics become more mainstream, people are more open to, but it's just transformative work when we're using something like a psychedelic to help people uncover and unblock and heal wounds as it relates to intimacy and sex, whether that be childhood wounds or sexual trauma or relational and attachment difficulties. It's just such a cool new paradigm. It's really exciting.
Yeah. And how would you describe or tell me and the listeners, like how does that work? Like what is it that psychedelics are doing that
Yeah.
gets to a different place than like talk therapy?
Yeah, I have listened to a few of your podcast episodes just in preparation of this. And so I hope this isn't like too edgy, but I think everyone thinks that it's just like sex on psychedelics, like big.
Right? Which maybe there's some value in that too, but that's not what that is,
Yeah,
right?
there
Yeah.
definitely can be. But like, how do we do it and what does it look like? And I have folks, I mean, I mostly work with couples these days, but I have also worked with individuals. And at times, if I'm working with a couple and, sexual trauma as an individual in their history, like doing a couple of medicine sessions to kind of target that as an individual thing is something I do as well. But how does it help and what does it do? Well, a lot of things. But I think some of the main things when it comes to sex and intimacy is it really allows us in a very gentle, safe, compassionate way, and in a safe way for the nervous system to let some of the defenses that have been built up throughout life soften so we can access more deeply rooted patterns or more shameful patterns or things that feel pretty exiled out to be able to be addressed in a way that feels safe and gentle. So I think the main piece when it comes to using it for trauma, I think it's that. But what it also does, depending on the medicine that we're using, but a lot of the psychedelic medicines, especially that we use in Colorado, that are more luckily legalized here
Okay.
for therapeutic use, is it allows just a sense of safety for the individual and the couple. And so it creates kind of this baseline of a secure attachment, of a secure bond that's loving and just feels like, I don't know, sometimes I say like an extra therapist in the room. So
Mm.
it allows us to explore these well defended for a reason places with a sense of safety. And so the work that I do is not about, ego death or blasting clients out and kind of going that route. It's how do we approach these issues with compassion, kindness, a secure, loving attachment to your partner if they're in the room with you, with the therapist, as I'm in the room with you, and create that sense of love, for a lack of a better word, to explore these places that are so sticky and hard and oftentimes dissociated from or traumatized.
So, in your experience, like what's happening in talk therapy or what's not happening in talk therapy that we can't get to that same? I mean, maybe sometimes you can, but like, how would you, I guess, describe the limitations of talk therapy in this context?
Yeah, and I always think about this because I'm a talk therapist. Like, that's my background. And I think insight and talk therapy is so important and so helpful. And I even like will do that at times with some of my clients. So, I think there are definitely limitations, and I think there are a lot of benefits to talk therapy. But the reasons why I think psychedelics kind of trump talk therapy when it comes to issues like this, one, I mean, there are actual biological impacts of the psychedelic just on the brain. And
Yeah.
so, antidepressant effects, decreased default mode network activation, which allows ruminations to kind of slow down and settle
Mm.
for folks. And so those, I mean, there are a bunch of others, but those are two main ones when it comes to like trauma and attachment that can really keep us stuck. And I think talk therapy, it's either we just have so many defenses that make so much sense.
Yeah.
We're approaching them in talk therapy, I think it's way harder and sometimes impossible, because if we're traumatized or we have an insecure attachment, or, you know, relationships aren't safe, we're asking the clients to do the thing with the therapist that like got them hurt in the first place, if that does make
Right.
sense. And so it creates just so much more of a safety in the body and the nervous system that I think we just like can't necessarily talk our way into sometimes. And
Yeah.
I think what the psychedelics can create is an environment for corrective experience, whether that
Mm.
be individually or for a couple, where, if we're in talk therapy, just kind of hashing out the fight of the week, that doesn't really occur, or it's way harder. And in my experience, like clients get tired
Yeah.
um, and kind of disengaged. And like, I think therapy is hard, but I don't think it should be something that we dread or cause more stress to our systems. I think we already have so much stress to our system. So I think those are all the ways psychedelics can help just provide a different experience.
Yeah. Yeah. And you are talking about just implicitly changing the chemistry and what's happening in the brain and the body, you know, in one go, I
Yeah,
suppose, like automatically.
yeah,
You
totally.
so you mentioned, creating this experience of safety. And I guess not having had a ton of experience with psychedelics, I've had some, but I mean, not therapeutically. It doesn't always feel safe. Like, I think people are afraid of being re-traumatized or a bad trip or like how is it that I mean, I don't know if you can guarantee safety, but like how is it that you can structure it so it's actually a safe experience and not something that's overwhelming or negative or
Yeah.
re-traumatizing?
Yeah. And I mean, I can't tell you how many clients I've had where they come to get support or heal from a traumatic psychedelic experience.
Oh, okay. So that might be part of what they're even bringing in.
Yes, yes. And so, for instance, I'm thinking of one situation where, you know, psychedelics, I think, are becoming mainstream, and we can be a little bit, I'm not the kind that's like psychedelics will heal everything. I think they're not for everybody, but I think what's different, if you work with a good provider who takes preparation and integration really seriously, and I'll kind of talk about what that means, is, as much as we can, getting to know a client's nervous system, getting to know their history, having their nervous system get used to us. I mean, before I use any medicine with my clients, we're meeting for 6 sessions, dry talk therapy sessions,
Okay.
get a feel for each other. And so we can talk about what are the fears, what are the hesitations, what happens if something negative or hard comes up in session, how do we deal with that? What about a session that doesn't necessarily feel hard until you go home to your partner afterwards? And then stuff that's brought up starts to feel hard. And like, how do I sleep in the bed with them at night? No, there's a lot that can happen.
Right. Right.
Um, and so I think it's about, one, like giving clients lots of preparation and helping them get to know you as a therapist, and also building that safety beforehand. And I think it's a lot about how do we support the integration, meaning like how do we transmute this from just being a big experience, good, bad, or ugly, into an experience that can also be a catalyst for your growth, right? You can take psychedelic medicine every day till the cows come home, or whatever that saying is.
Right.
But if what are we doing in order to kind of capitalize on the brain effects, on the relational effects, on the insights, on the nervous system changes, and integrate those into your life? So that's where I do think psychedelic therapy is different than, kind of like going to Peru and drinking ayahuasca in the jungle. I think there's a time and a place for that, and that can be beneficial. But when it comes to things like intimacy, trauma, safety, doing it with a therapist who is well trained and like isn't just gonna feed you psychedelic medicine, that is gonna say, hey, this is a process, let's prep and let's integrate as we go. And hard things do come up in session. And I think too, you know, helping a client make a choice of this is something that they want to do at this time, right? Like I have had people come to me, and whether it's like, we have a month before I go and I move, like that's probably not the best time to do something like a psychedelic
Yeah. Right. 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 Feel rushed and not have the
yeah,
time to process after. Yeah. Yeah. You mentioned not for everybody. I'm curious your thoughts about who is this for? Who is this not for? What are your thoughts about that?
yeah. And this has evolved like since I've been doing this for so long. I mean, I think when we do any training as therapists, we kind of have like the diagnosis or the type of clients that it works best for and doesn't work for. And I mean, the high level answer would be sometimes psychedelic medicines are not beneficial for people that have a history of bipolar or manic episodes or psychotic features. And that all is true. But through doing this, for over 5 years, what I have found is who it's not for are people who don't have any support. Like I find that to be more dangerous, and that's where it
Okay.
can be, almost overwhelming. Like clients, whether they need to have a supportive relationship outside of the therapist. And, that's not to say, at least for me, like a client comes to me, you don't have a support, see ya. Well, let's work on that. Let's
You're
work
right. Right. Yeah.
attachment dynamics or trauma or fears to be able to get you like supportive relationships outside of here. But I think having an infrastructure and a lifestyle that allows you to support this really deep work is vital and really important.
Yeah. Okay. I'm trying to figure out I've got so many questions, like which direction to go. Let's do this. If you could talk about the medicines you use and like what is the process? Like what does this actually look like if you were going to take, like, let's say a couple comes to you around sex and intimacy, like walk me through a little bit of what you're doing, how this works, and like what medicines you use and for what purpose.
Yeah, so in Colorado, and Oregon, but I'm based in Colorado, so more familiar with kind of the legality here. We use ketamine, and we can also use psilocybin and other plant medicines like 5-MeO-DMT, ayahuasca. Those aren't things that I necessarily use in my practice, but I know people that are using them. But primarily, like if you were to come to me, we would use a combination of ketamine and psilocybin if appropriate. Sometimes clients have experience with one or the other, or are more curious about one or the other. And sometimes based on a couple's presentation or a client's presentation, one medicine is probably better to start. And I can talk a little bit more about that if you're curious. But what we would do, and not to complicate things, like, this can be done a bunch of different ways. We do a lot of these in intensive retreat formats because, a lot of folks' lifestyles these days are super busy, and
Yeah.
moments of connection are far and few between. And so, being able to take time to not only do the medicine work, but also be able to kind of limit stressors. You don't want to be doing a big psychedelic medicine session and then go right home to the drop off line. And
Right,
you
right,
want
right.
to have some time and space. But you would come and we would do a series of prep sessions. If it were with a couple, I'd meet with the couple probably one or two times, understand really what they're wanting to achieve, understanding what their background and experience with therapy, traditional couples therapy, or psychedelic experiences, if they have any. And really just kind of orient them to this process, talk to them about what their goals are, their blocks are, do some education around the nervous system and somatic practices. And then, depending on the medicine, ketamine is a prescription medicine. And so they would need to get that prescription from a medical doctor, a nurse practitioner. And psilocybin does not. So you don't need a prescription for that. And then we would do a series of medicine sessions. And so what I like to do is do a medicine session with the couple. And so that's where the couple are both taking the psychedelic medicine, and we're doing an experiential therapy process in that setting. And so, it's not that they're up talking face to face. They're lying down with eye masks and music playing. And it's really a guided process of, what do you notice in your system as you lay down next to your partner, as the medicine starts to take hold, as your partner reaches out for your hand? And does that touch feel good or not good? And we're just processing through emotions, thoughts, beliefs. Sometimes parts come up, sometimes fears come up. And so we're able to process that in a session. And then I would meet with them.
So you're talking, you're guiding them through that. They're talking, answering. It's a pretty interactive.
Yes.
Okay. And are you starting at a really low kind of dose, like a starter? You
Yes.
work up over a series. Okay.
Yep, totally. Yep, exactly. And a lot of it is, it's really cool. A lot of it is noticing what is happening in us as our partner is going through something. So if it's okay, I'll give an example, because
Yeah,
my
yeah.
husband just did a series of medicine sessions with a mentor of mine. And what is my impulse as my husband is crying? Is my impulse to like go and rescue and save him? Is my impulse that I feel like he's taking up all the time? Is my impulse to, distance myself from him? A lot of it is noticing what is going on inside of us as my partner is having an experience.
Mhm.
Um, and then, as it so naturally and beautifully does, I'll focus on one partner and then have the other partner kind of notice. And then I'll go over to them and have them share and notice. Partner B, what do you notice? As partner A talks about what it was like for them to bear witness to this. And that's just an example.
Yeah, yeah.
But really just kind of noticing our relational impulses and our reactions to things like vulnerability, touch, closeness, intimacy. As your partner reaches out to hold your hand, does that feel nourishing to you, or do you have protectors go offline? So there's a lot of things that can be done in this session that are just kind of noticing our impulse reactions, belief, emotions. Um, and so we'll do that. And then we'll meet for like an integration session. So that's a session without the medicine, just to kind
Hmm.
of unpack, how was it for you? What came up afterwards? How are you guys feeling, now? What further work do we have to do? And we'll do a handful of those. And, at least in my belief, that the goal is to eventually be able to do this at home or feel close enough that you won't have to rely on these big medicines to get you to a place of vulnerability and noticing our reactions and patterns, right? Like the psychedelics are a catalyst, and with integration and proper support, like you can change your life and you can
Mhm.
change your relationships. And so a lot of the integration is, okay, what came up in this session? How are you feeling? Okay, try this now this week. And what is it like to, I'm thinking of an example, like lay in bed naked next to each other and not engage in sex, right? Just kind of be in that state in between. Um, and we'll do a series of that. And, depending on how it goes, maybe I'll do a medicine session with each partner individually if that's something they're interested in and could benefit from. And then typically my clients kind of go on their journey and keep me updated. And I just got a really sweet Christmas card from a couple that came to one of our retreats last year, just like, we're doing great. I feel like we're on our second version of our marriage, and this has been so impactful and beautiful. And so I'm definitely not saying it in the world of like it's a quick fix, but
Right, right.
process is a deep process. And I think like it can create, and I've seen it create really sustainable shifts for couples uh,
Wow.
later down the road.
And so when you're saying this retreat format, is it like one joint session and one, I mean, is all this happening over the same few days? Is that how this is structured, or
Yeah.
do people come back for sequences of weekends or something?
Yeah. So I know I made it kind of confusing there. I get so excited talking about this stuff. I'm like, wait, breaking
It's
it
okay.
everything. I'm
That's
like,
why I ask
people don't know what
questions,
you're
right?
talking about. I mean, I have couples that I've been seeing for the past like year, right? That kind of come to see me once a month and do medicine. I would say at first, with just traditional psychedelic medicine, it's a series of prep sessions and probably a more intensive series of sessions. Probably once a month for a few months are the big medicine sessions, and then
Okay.
integration. And then the session before they even get to the retreat house, the medical evaluation is already complete with our provider, our medical provider, prescriber, and they come and we start that night, and we start with a ketamine session, and that is done in a big group format. And so we have
Huh.
like 4 facilitators, and we're walking them through different prompts. And then the next day we do a whole kind of workshop on attachment, intimacy, and connection, and then they do a private couple session, and then some integration that night and integration the next day, followed by a final ketamine session that day, fully guided and kind of curated alongside the bigger picture that we're doing. Yeah, and then they leave, and we provide support, and they're always welcome. And we kind of have support plugged in, integration calls and support calls afterwards. But we have found with that retreat format, I will say, I think it's the 3 sessions. I mean, it's hard and it's a big deal.
Yeah.
Uh, and it's not great for every couple, but it does seem to be the catalyst, because it's like an intimacy and attachment boot camp. You
Hmm.
do this work, and you have support along the way, and you go home and you implement the tools that you learned, and changes that you made in the actual sessions. So yeah, I'm kind of saying 2 things. One is a very short-term intensive format, and then one is more of a longer term kind of process.
Right, right. But either way, the medicine sessions need to be long enough and enough space carved out. Like you said, they're not just going to pick up their kid at daycare right
Yes.
afterward. Right. Yeah.
Yes, 100%.
Yeah.
Totally.
And you mentioned a medical provider, like an exam going into the retreat. Is this something like with these medicines? Can you just be there with them while they're taking them? And I mean, are there side effects or medical things you're having to watch out for? Is there a doctor on call? Like, what's going
Yeah.
on with that part of it?
Yeah, I mean, I can't speak for everybody. I know some practitioners, have less of a focus on kind of the medical side of things. I take that really seriously, because these medicines do have side effects, and there are risk factors, and there are things to consider. So since ketamine is a prescribed medication, our provider has to meet with the client, make sure they're safe and appropriate, educate them on the side effects and risks, and then we'll be on site to actually provide and facilitate the ketamine by injection on the retreat. We also can use self-administered lozenges. And so if appropriate, the medical prescriber will write the prescription. The client will go pick it up from their pharmacy and bring it into the session. But I'll be honest, I've had some medical events in session that are scary. And although I treat
Yeah.
medicines like explicitly or implicitly, I don't even know if that's the right word, like they are a big deal, and they can affect our bodies. And so common side effects, nausea, vomiting, dizziness, tiredness. But I think it's really important to do these medicines safely, and that's therapeutically, but also medically. And so
Yeah.
when clients are coming in and doing kind of the bigger sessions, I want to have a medical provider on site to be there in case anything does come up, because the last thing I want to do is traumatize a client more, right?
Right. 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 Right.
So that's something I take really seriously and is really important to
Yeah.
me.
Okay. And you mentioned Colorado and Oregon. Are those the only two states right now where this kind of psychedelic assisted therapy is legal?
Yeah, so
Explicitly legal?
yeah, that was where I was going with it. It's happening underground throughout the country, and I think throughout the world. But ketamine is more widely legal. Me and my colleague, who's my MP that I work with, we just flew out to Cape Cod to train a team with ketamine. It's interesting to go there, and we were there, and they were like, we're the first ones here doing ketamine. I'm like, oh, we've been doing it for 5 years, and everybody's
Yeah.
doing it out here. Harder to find as someone not doing ketamine therapy, at least in the circles I run in. So ketamine is more widely available. When it comes to psilocybin and the other plant medicines, Colorado and Oregon, to my knowledge, the time we're speaking, are the only places where it is explicitly legal for therapeutic use and personal use.
Hmm. Okay. And where do you think this is all going over the course, in the next decade or so? Or where do you hope it's going? What I don't know if those are two separate questions, but like, what do you think will happen?
Yeah, I mean, I hope that we can continue to do the amazing work that we're doing and just help more people, I think, and help more couples just create the relationships and lives that they deserve and that they want. And so I hope we can continue to do that on a greater scale. What I hope, two things, is one, that this type of work empowers clients and therapists to do more experience-based work. I think as therapists, especially for me, I was trained as a traditional therapist where you like sit in the seat for 50 minutes and you talk to your client and then they leave, right? And again, I think that there are beautiful things that can happen in that format. And I think if that worked, we wouldn't be in a mental health crisis or
Right,
mental
right.
health pandemic. And so I hope that it empowers people to be more creative and dynamic when it comes to and accepting, when it comes to healing and using these modalities for healing. And the other thing I really hope it does is empowers just a sense of like, no matter what you've been through or what your relationship has been through, I think a lot of times there can be this sense of like, I'm broken, this is a lost cause. Like something else I've seen with these medicines is the most traumatized individuals, the most traumatized couples, like can find presence and healing and compassion for themselves and deeper connection. And I hope it just can inspire more people and like allow them to feel less alone and less ashamed of what they've
Yeah.
experienced.
I would imagine if it's legal in a couple states, it's like there must be some, I don't know, support to get this legal more places and have this grow in terms of a scientific body of work too.
Yeah, there's more and more research coming out. Every week I'm on these listservs, and I feel like every week there's more and more research coming out to support this work,
Yeah.
support it in ways that are beyond just like you mentioned at the beginning, trauma and depression for couples, for intimacy, for sexual um, dysfunction, for just general like spiritual growth. And so it's really cool to see it take off and have a body of research to support such a robust, clinical world that sees it and believes in it, to have the research come out and support that. It's really cool to watch.
Yeah. Yeah. Well, thank you. Will you talk? Where can people reach out if they're interested? They want to know more, and I
Yeah,
suppose they have to come to Colorado, but just let people know how to contact
yeah,
you.
yeah. Colorado is beautiful. You want to come here. So
It's
trust
always
me.
worth a trip, right?
Yes. Yeah, you can find out about more about me and my work. And I mean, I love to nerd out about this stuff. So if anyone's listening to this and just has questions or in their own area, like I have a lot of wonderful colleagues all over the country. And so even if you're not from Colorado, have no plans to come and still want to do this more in a legal format, reach out to me and I'm happy to give you, any names that I have of trusted referrals. But you can find me on Alchemy Therapy and Wellness is the name of my group practice. And then New Heights Experiential is the name of our couples retreat company.
Perfect. Thank you so much.
Thank you so much, Jessa. This was fun.